What's going on, guys? Welcome back to Mount Olympus. My name is Daniel House, of course. And today we're going to be talking about a low-cost, over-the-counter option to address your hair loss. Yes, so today we're going to be covering the ups, the downs, the side effects, how it can affect you, and what my recommendations are as far as minoxidil is concerned in your hair loss journey. Let's talk about it. What's going on, guys? Welcome back to Mount Olympus. My name is Daniel House. I am the owner, founder, and lead SMP artist over at Mount Olympus SMP, located here in Atlanta, Georgia. And today we're going to be covering minoxidil. I know it's a very, very lengthy topic, but I'm going to be talking about all the ups and downs, all the side effects, and what my thoughts are about you taking minoxidil. So again, these videos that I make are kind of help you people navigate all the different options that are out there, helping you weigh if SMP is good for you, if over-the-counter medication is good for you, if getting prescribed from a physician is good for you. Everybody's different, okay? Just because we do SMP here does not mean we're gonna force SMP down everybody's throat, okay? We're here to work with you to help you figure out what it is would be the best options for you. So today, we're talking about minoxidil. Okay, so minoxidil was first discovered back in about 1984, 1989. Okay, in that range, give or take. So 30, 35, 40 years or so. So minoxidil was first introduced to actually address high blood pressure. So we're gonna talk about today some of the side effects. And of course, some of the side effects are a byproduct of it being a medication that was actually intended to treat high blood pressure. So they noticed when they started to treat patients with minoxidil, they noticed a side effect that people were going through is they were sprouting up hair. You know, they had women growing facial hair, growing beards, people growing unibrows. They were like, man, we need to package this and sell it as a freaking hair growth formula because Chewbacca.
Corn.
If you have low blood pressure or you're having an issue regulating your blood pressure, they're either normal or a little bit lower than normal. What you could actually notice is you can notice dizziness, standing up too fast, feeling faint, feeling like you want to pass out, because minoxidil could actually lower the blood pressure because it is a blood pressure medication. Well, it started off as a blood pressure medication. So individuals who have high blood pressure could help to regulate your blood pressure if you're already on blood pressure medication, but that's also a side effect to look out for. So it could actually make you lightheaded. Also, even if you're already on a blood pressure medication that regulates your blood pressure, minoxidil could drop your blood pressure even low. So depends on your genetics. It could help you, it could hurt you. It really just depends, right? That's why I always recommend taking low doses and just seeing how it affects you and then going from there. And so because it was a high blood pressure medication in its infancy stage, it's important to understand that another side effect that is directly correlated to high blood pressure medications is that minoxidil could actually cause you to retain more water weight, okay? So those are two things to be on the lookout for. So feeling faint and dizzy, or also just retaining more water weight. Like, these are two things to think about, okay? So let's go to some of the positive things, okay? So positive things are a lot of doctors who actually are doctors of the scalp would also highly recommend minoxidil as an over-the-counter medication, because minoxidil also comes into 3 different forms. You can take the liquid form or cream form, the foam form, or the oral form. Okay, so the pill form you would actually have to get prescribed from a doctor. Now, but there are side effects associated with the pill form that's not associated with the liquid form or gel form, cream form, or the foam form. For example, when researchers discovered that minoxidil was great for treating hair loss, because they noticed that when they were treating people with minoxidil, they were growing hair, they decided, hey, let's just take the actual active ingredients, let's make it more concentrated, but let's make it to where people can apply it to the area that they want to, create hair growth. And so when you're using it as a cream, the other caveat is you want to make sure that you're actually applying it to the scalp, okay? Minoxidil is not effective if you're applying it to your hair. You want to apply it directly to the scalp. So you want to massage it and get it directly on the scalp, okay? So with that being said though, because it is a topical cream that you put on top of your head, it's concentrated. So imagine if I take a pill and now it's in my bloodstream, I could grow hair really anywhere. And so that's another side effect of individuals who take the pill form. Primarily women have complained about growing facial hair. Okay, so it's important to understand, if you are a young lady suffering from alopecia, it's important to note, if you get the oral version of minoxidil, you could potentially grow some facial hair. So that's something that you should be aware of. That's something you should talk to your doctor about, and then see if maybe the oral version is for you. My recommendation is, as it relates to minoxidil, is to stick with the foam version, okay? Because the liquid form, your gels or creams, are reported to actually cause skin irritation. And the reason why they cause skin irritation is because of the active ingredients that's actually in minoxidil. You have three major compounds that are in minoxidil. You have alcohol, propylene glycol, and water. So as we know, propylene glycol can aggravate the skin. Okay, so the foam version does not have the propylene glycol inside of the actual product. So what I would say is go with the foam version. It's not gonna aggravate your skin. It's not gonna cause itching, and you'll notice a lot more retention, because the thing with the foam is the foam version actually absorbs within 5 to 20 minutes into your skin. Now, the actual cream version or the liquid form could actually take up to an hour or two to actually soak up into the skin. Most researchers say that about 60 minutes it can actually be absorbed into the skin. Now, when minoxidil is actually absorbed into the skin, it can stay in your skin, into your scalp, for about 21 hours. Okay, so most people would say, oh, well, I took minoxidil, I got to walk around all day for hours until I can wash it out or wash my hair. That's not true. After about an hour, taking the cream or the liquid form, or about 20 to 30 minutes after taking the foam version, you can actually wash your hair, start your day anew, because it's actually soaked up into your scalp already. Okay, so here is the biggest takeaway about minoxidil that could potentially turn some people off minoxidil. It's all about the way that you look at it, okay? So about 50 to 60% of people will notice some type of hair growth from minoxidil. The other 50 to 40% will not. Now, the individuals that do notice that minoxidil actually helps to promote hair growth, they will notice a lot of their hair falling out. Why? Because minoxidil is going to stimulate hair growth. And as we know, shedding is a natural occurrence that happens with hair growth. So what's going to happen is, for a lot of individuals, you're going to have a lot of hair fall out because new healthy hair is growing and coming back in and pushing those follicles out and making room for new hair follicles. Now, some people would say, look, bro, I'm not taking that for me to be losing hair. And some people would say, well, I know my hair is already damaged, or I'm more concerned about the healthy hair coming in. Now, the other caveat about minoxidil or any topical agents that you take, once you start taking them, you cannot stop taking them. They become a part of your lifestyle. It's just like a multivitamin. You're gonna stop getting the benefits from a multivitamin if you stop taking it. Make sense? So, which is why a lot of individuals who look at minoxidil, hair transplants, vitamins, changing their diet, a lot of people just like, hey, you know what? I think S&P is just the best route for me, okay? I like wearing my hair low. I wanna wear my hair low. And I feel like just getting S&P and just spending 2 or 3 hours, 1 or 2 sessions to actually redo my hair, and then I don't have to worry about minoxidil or a hair transplant. I'm just good to go. Just need a touch up every now and then. So it really just depends on what your threshold is, okay? Are you someone who is good at taking vitamins? I know even myself, like sometimes I might forget to take a vitamin. I'll look up and be like, man, in 2 days, I've got to take my vitamin. Are you someone who could forget to take your minoxidil? Are you someone who is not really good with routines and being repetitive every single day? Are you not someone that wants to sit here and spend the cost of, are you someone that doesn't want to sit here and spend every single week, every single month, extra money on minoxidil? So I tell most individuals this: if you want a full look and you don't want to be bogged down with taking minoxidil consistently over and over again, if you're not really excited about the side effects, you don't want to grow facial hair, S&P might be a good option for you. But it's still important that you guys get a consultation, have somebody analyze your scalp to see if you are a good candidate for S&P. You may not be, you may be, it just depends. But it doesn't hurt to find out, to get a consultation and just ask and find out if S&P would be a good route for you. So if you're a little bit curious about what S&P actually is, I have a video here that I tagged in this video that we talk about what S&P is. We go a little bit more into detail and explain what S&P is. So if you're curious, check that video out. With that being said, guys, that's our video for today. If you guys like this video, please feel free to share with some of your friends. Like, share, and subscribe. If you have any questions about minoxidil, please feel free to leave them in the comment section below. I'm excited to hear from you guys, and I would love to converse with you about this topic. With that being said, if you guys are in the market for S&P or you're interested, feel free to reach out to us, message us, email us, let us know you're interested. And if you want to schedule a free consultation, you're more than welcome to come into the office. We are located in Atlanta, Georgia, and we'd love to meet you. With that being said, have a great day.